More Idaho Matters now from the studios of Boise State Public Radio News. I'm Gemma Gaudet. There are more than 7,000 rare diseases, and 25 to 30 million people in the United States are fighting one of those every day. Now, many of those impacted are children who need extensive medical care, and many of them are treated at home by their parents and family. And it is a full-time job, and it can leave families struggling with simple day-to-day tasks like mowing the lawn or picking up groceries. An Idaho nonprofit is helping families pick up that slack as they care for their medically fragile children. It's called Raise for Rare, and its president and CEO, Megan Schomer, is here to tell us more. Megan, welcome to the program.
Thank you for having me.
So, Megan, how did Raise for Rare get started?
Raise for Rare began in 2017. I actually had a medically fragile child. He was born in 2012. His name is Corwin. And what I experienced on that journey was just so much isolation. Families are at home doing the cares on their own, and they really are on their own. When you go up to the hospital, you have a lot of support from the medical staff, and a lot of charitable organizations go to the hospital and offer support. But when you're at home with these really complex kids doing the day to day, you truly are on your own. And so after he passed away, I really wanted to bring a light to this community. I feel like there's a lot of isolation, and unfortunately, healthcare systems can't connect the families due to regulations, but nonprofits can. And so we offer community support and just a little bit of light when skies are gray.
So, Megan, I think it can be isolating even with a healthy kiddo, right? Especially those that first year of parenthood, right? With the baby stage and all of that. It can be extremely isolating. I can only imagine, probably 1,000% fold how isolating it is when you have to take care of a sick child 24/7 around the clock. Talk to me about what your day would look like with Corwin, and how difficult was it just to do simple day-to-day tasks?
Well, you're right. It is. It's 24/7. You're doing constant cares. There's medication. So in the morning, you wake up, there's medication preparation for the entire day. The morning regimen was about 7 different medications. So I would administer those. There's preparing feeding for a feeding tube. There were oxygen treatments. He had a percussion vest, which shook his body to release fluid in his lungs. He had a machine called a cough assist. So you do all those cares. On top of being a total care child, there were diaper changes, hygiene, brushing his teeth, just taking care of him in general, like you would a newborn. But then you have all these other
Mm-hmm.
complex things with machines and feeding supplies and medications. And then you go into the day where there are therapies. We were at the children's hospital or at therapy centers multiple times a week, sometimes, multiple times a day. So just going and taking one of these children somewhere is also very difficult because you have to, load them up. You have to take all of this equipment with you everywhere you go. So suction machines, feeding supplies, all these everything has to always be with you. So packing all of that up, unpacking it, and you're of course in usually handicapped vehicles. So finding parking, which is really challenging for the vans, and being able to, unload all of that. It's very physically taxing on the parent and caregiver to be able to load and unload them and get them into all these appointments. And then, you get back home it's a constant cycle. It depends on the day. If he was having a good day, medications were every 4 hours. If it was a bad day, we're doing medications and breathing treatments every hour, 24,
Mm.
24 hours a day. So that would be no sleep. I didn't essentially get REM sleep for about 5 years doing all of his cares, just because you can't fall into a deep sleep when you are the monitor for your child at home. So
Yeah.
he also had severe epilepsy. He had nearly every kind of seizure you can imagine. So at the time, there weren't really good seizure monitors. So I would essentially sleep with my arm across him so I could feel if he was moving, and just kind of always being in that hypervigilant state when doing all of this.
Mm. And Megan, unfortunately, the story you just told about your experience, I am assuming, is not unique.
It is not. And when I went through it, I actually didn't know any other families on that journey. And that's what I think made this so isolating is there really was no
Hmm.
connector in the community. And that is why, as an organization, we are non-diagnosis specific, is because at the end of the day, I realized it doesn't really matter what that label is, especially with all these rare diseases. Sometimes there's only one or two children in a state that might have a condition and they don't know each other. But at the same time, if they are all, receiving if G-tube therapy, so, feeding supplies and oxygen and all these things and breathing treatments, it doesn't matter what that label is. They're all going to the same children's hospital, seeing many of the same specialists, and dealing with a lot of the same medications. So that journey is very similar, whether the diagnosis is the same or not.
So, what kind of support does Raise for Rare provide? Because I have to imagine there are not enough hours in the day to do this simple task. I mean, I mentioned even, grocery shopping. I mean, you can't take your medically fragile child to the grocery store for, I mean, as you described it, for just, oh, well, we're out of bread. Let's load up and go.
Right, right, exactly. Well, in a wheelchair and all that equipment, it's
Right.
just not practical. And so oftentimes, this was before grocery pickup when this all started. And so
Hmm.
we realized that need, and especially during COVID when kids really shouldn't have been out in the community, or even now, cold and flu season, even this year, it was especially tough. We have a lot of our kids that have been hospitalized and they really just can't risk getting these infections. So grocery delivery is important for them. We offer support. So we do support groups in our office 4 times a month where caregivers can get together and just visit with each other, find community, connect, talk about the hard things, the funny things. There's things that in this community you can't really talk about with just regular people because they wouldn't understand it, or maybe the humor of some of it. And so finding community through these support groups. We offer individual therapy in our office. We do events that bring the families together as a whole so they can find other families in the community to connect to and be friends with that have understanding. So when they're at a family event and they need to do cares for their child, like change a G tube or, put in a new feed or whatever, they're not looked at. That's just normal, commonplace among what our families do. So they really can connect with each other. Nobody's staring, it's just normal for all of us. And then we also do, we've identified that siblings oftentimes are overlooked in these family dynamics, not
Hmm.
intentionally, but when the parents
Hmm.
are so busy caring for the complex child, the siblings can feel a little left out. They don't understand doctor's appointments and therapies aren't special attention. I mean, to them, they just see it as, a form of neglect. And so we have sibling programs that bring the siblings together with other kids that understand the sibling perspective. We do an event for our moms for during Mother's Day week where we go and pamper our moms. We do an event for our dads. We take them axe throwing. We do and then we do our in-home supports, which include things like lawn care, grocery delivery, snow removal, house cleaning, just to take a little bit off the plate of these families so they can utilize that time in a different way. They can take a break, they can rest. It's a form of unconventional respite. They can spend time with a sibling. They could go on a date. It just allows them to, it just gives them a little bit more time back. We can't buy our families time, but we can improve the quality time they have together.
Hmm. So, where did the name Raise for Rare uh, come about?
Most of our children have a rare disease. And so that is where the name initially started. They either have a rare disease or they've survived a tragic accident that makes them incredibly rare as well. So they're impacted
Mm.
in a rare form in many ways. Like I said, it could be the condition, it could be surviving something that most people wouldn't. And so we wanted to shine a light and be sunshine. We want to shine a light on our families with support, but also shine a light in the community and let them know these families exist. You may not see them, you may not see them out and about, but there are more than 7,400 medically fragile children in our community.
So, how can families be referred to Raise for Rare? How do they find out about it?
So most of them come from our local healthcare systems, care coordination, providers. Sometimes when they're admitted in the hospital, they get referred to us. But anyone can go apply. The application is on our website. And so it's all online. They don't need to print it or anything. They can go in, see if they qualify and if it's something that would help them, and they can just apply online. We receive it. And once we receive an application and it's approved, they are welcomed in. They receive a welcome box full of support and love from us, a little bit of sunshine. And in those boxes are also a hospital cafeteria card that we refill. So even when families are admitted to the hospital, they always have access to food. Or if they're up there for a day of appointments, like I said, sometimes you're there multiple times, multiple appointments in one day. And so they're hungry or they just need a coffee or a rest. And so it gives them a little bit of respite too, even in the healthcare setting. But most of our families come from the healthcare system.
How important is this service, Megan? I mean, even as you said, right, getting someone a cup of coffee. I mean, to maybe shoveling their sidewalk when it snows.
It's vital. And a lot of our families, initially when we first came out, were sort of hesitant to try to get more support. I mean, they're already dealing with insurance companies and all these different things of, is this just one more thing that I'm going to have to do? And then when we come in, once that application is approved, they don't need to do anything else. We just show up for them. And so we've had families, I mean, we have pages and pages of thank yous of how life-changing it's been. A lot of families don't realize how much they're carrying till we take something off their plate and they can breathe a little bit and just realize how much that they're taking on and that this can really help them. So just the support it's like I said, we get thank yous all the time of just how life-changing and how supportive and loved they feel.
Mhm. And I know you're a nonprofit, Megan. How can people help raise for rare? I mean, do you need volunteers? Do you need money? How can
Yeah.
the community make sure that you continue to be viable?
All of the above. We always can use volunteers. That volunteers can sign up on our website. We always need donations. Right now, we have a wait list for services just because we have over 200 families that rely on us monthly for support. So right now, we have a
Wow.
wait list for some of those services. So donations are vital to our organization. As you said, we're a nonprofit. So that is how we operate. We need those donations. We do have a golf tournament coming up in June 6th. This information is all on our website. We do a fun cookie event in August, Cookies for a Cause. And then we have our biggest event, which is our Sunshine Gala in September. So attending any of these events or donating online or volunteering, it all gives back and it all makes a difference.
Well, I'm on your website right now, and I love the slogan that you have with a picture of many of the families that says light when skies are gray.
Yes.
That really sums up your organization.
I think so. I think it's like I said, it's shining a light on them for them and just encompassing them with that bright light and love and letting them know that our community is there for them and that, we see you.
Well, Megan, I want to thank you so much for taking time to talk with us. Really appreciate the conversation.
Yeah, thank you for having me. I really appreciate it, Gemma.
We've been talking with Raise for Rare President and CEO Megan Schomer about how this Idaho nonprofit is helping families of children with rare diseases. We will, of course, put information on our website. So if you would like to volunteer or donate, you have that opportunity. I'm Gemma Gaudette, and this is Idaho Matters.